Bismillah ar-Rahman ar-Rahim. Today we will discuss the muscles of the forearm. The anterior compartment consists of three layers: superficial, intermediate, and deep. The first muscle here is the pronator teres. Pronator teres is a muscle originated, this is the origin of pronator teres, from the medial epicondyle and from the ulna, and inserted into the radius. This is the pronator teres, and this is part of superficial group of muscles of anterior fascial compartment, and this is the pronator quadratus, originated from the ulna, inserted into the radius. It is part of deep group of muscles. Both of these two muscles share the pronation of the hand. That is, the palm will face downward. The palm will face downward. This is the pronator quadratus muscle, and this is the pronator teres. The other muscles of the superficial layer of anterior facial compartment, this is the flexor carpi radialis. This muscle is the flexor carpi radialis. This muscle is the palmaris longus, which is not always present, and this is the flexor carpi ulnaris with flexor carpi ulnaris. All these three muscles originated from the medial epicondyle, and the flexor carpi radialis inserted into the second and third metacarpal, while the palmaris longus inserted into the palmar aponeurosis, and the flexor carpi ulnaris inserted into the pisiform bone and the base of the fifth metacarpal bone. The function of these muscles are flexor of the wrist joint. The flexor carpi radialis also perform abduction, while the flexor carpi ulnaris perform adduction. All these muscles supplied by the median nerve. This is the median nerve. Here is the median nerve. This median nerve. This is the ulnar nerve. This is the ulnar nerve. This is the medial epicondyle. The ulnar nerve passes behind medial epicondyle. And this is the brachial artery, and this is the profunda brachii. The intermediate layer consists of one muscle. This muscle is the flexor digitorum superficialis. The flexor digitorum superficialis is the muscle that supplied by median nerve, originated from the medial epicondyle also, and inserted into the middle phalanx, and it performs the flexion of proximal interphalangeal joint of four fingers: the index, middle, ring, and little fingers. Now we will discuss the deep group. The deep group consists of three muscles: the pronator quadratus, which we have seen it before, and two other muscles. This one is the flexor pollicis longus. The flexor pollicis longus inserted into the distal phalanx, performing flexion of the interphalangeal joint of the thumb. Flexor pollicis longus. And this muscle supplied by the median nerve. These tendons here deeply are the tendons of the flexor digitorum profunda. This is the flexor digitorum superficialis, and here is the flexor digitorum profunda. Flexor digitorum profunda inserted into the distal phalanx here of the four fingers. This muscle, the flexor digitorum profunda, supplied by the median nerve and the ulnar nerve. The part that perform function on the index and middle finger supplied by the median nerve, and the part that perform function on the ring and little finger supplied by ulnar nerve, and the function of the muscle is flexion of the distal interphalangeal joints of the four fingers. Now we will discuss the lateral facial compartment. Lateral facial compartment consists of two muscles. This is number one, the brachioradialis. This is the brachioradialis, originated from the humerus supracondylar ridge and lateral, and inserted into the style of the process of the radius, supplied by radial nerve, performing flexion of the elbow and keeping the forearm in a mid-pronation position. This one muscle here has been cut. This is the origin of the second muscle, also originated from the supracondylar ridge and inserted into the second metacarpal bone dorsally. This is the extensor carpi radialis longus. Extensor carpi radialis longus, supplied by radial nerve and perform extension of the wrist and abduction of the wrist. Posterior facial compartment consists of two groups of muscles, superficial and deep. These muscles are the brachioradialis and the extensor carpi radialis longus. They are forming the lateral compartment. And this is the extensor carpi radialis brevis. Extensor carpi radialis brevis inserted into the third metacarpal, extend and abduct the wrist joint. This is the extensor digitorum, which extend the finger and insert it into the extensor expansion of all four fingers. All superficial group originated from the lateral epicondyle. This is the extensor digiti minimi to the little finger. It performs extension of the metacarpophalangeal joint of the little finger, and this is the extensor carpi ulnaris, which extend the wrist and adduct the wrist. All the muscle of superficial facial compartment are supplied by the radial nerve, and this is the extensor retinaculum. The deep group of the posterior facial compartment consists of this muscle. This is the abductor pollicis longus. Abductor pollicis longus inserted into the base of the first metacarpal, performing abduction of the thumb. And this is the extensor pollicis brevis. The extensor pollicis brevis inserted into the proximal phalanx, performing extension of the thumb. Abductor pollicis longus, extensor pollicis brevis. All the muscle of the posterior facial compartment supplied by the radial nerve. Here we have the extensor pollicis longus. This is the extensor pollicis longus, and this is the tendon of it inserted into the distal phalanx, performing extension of the thumb. Extension of the thumb. And below the extensor digitorum here, there is another muscle performing extension of the index finger. We call it extensor indicis, and this is the tendon of extensor indicis. This is the tendon of the extensor indicis passing below the extensor retinaculum here and go deep into the extensor digitorum. This is the last muscle in the posterior facial compartment, the supinator, originated from the lateral epicondyle. Lateral epicondyle. This is the muscle. This is the muscle, and inserted into the radius, performing supination. This is the supinator muscle, and supplied by the radial nerve. This is the elbow is open. This is the capitellum, and this is the head of the radius. There is a small muscle behind the triceps. This is the triceps. Behind the triceps, anterior to the triceps, is a small muscle anterior to the triceps, originated from the lateral epicondyle, inserted into the olecranon process of the ulna, and performing extension of the wrist, supplied by radial nerve. Some books regard Anconeus as a part of the triceps muscles.